Hello, my name is Joe Rule. I'm a partner with Excel Physical Therapy, and we're starting this new webinar where we are hopeful to share pertinent and useful information to help you live a healthier and more pain-free lifestyle. Today, we're happy to have Drew Ward, the clinic director of our Royersford Clinic. He's been with Excel for 5 years and has been the clinical director in Royersford for 2. And we're going to talk about some of the things that we're doing in the clinic and some of the things that have changed to help people get the physical therapy that they want and need through this trying time. So, Drew, thanks for joining us here today.
Thanks for having me, Joe.
Oh, gosh, I'm looking forward to. So you are the initial therapist on our webinar, so couldn't be happier.
Lucky me.
So, Drew, on a personal note, how are you making out through all this this time?
Well, as everybody I'm sure feels the same. It's a big change. There's lots of things that are happening through our world, and it's a trying time. It's a difficult time. I'm doing personally fine. My kids are going a little stir crazy, not being able to go to the playgrounds and things like that. But otherwise, we're holding our own. Awesome.
That's great to hear, and I think that's your kids aren't the only ones that are going through that. So, so let's talk about physical therapy here. So when should a patient call to try to set up an appointment for physical therapy?
So the way that my personal feeling is that anytime that anybody has any increased pain that they're pretty sure is musculoskeletal, whether it's back pain or they feel a strain or sprain from something that they're doing in their daily lives, the best way to get into physical therapy is to call the office. We can kind of direct you one direction or the other if we feel that it's something that physical therapy isn't appropriate for initially. But there's very few things that are musculoskeletal diagnosis that aren't appropriate for physical therapy.
So a patient can just call. Do they need to see their physician first to come in, or how does that work?
Lots of times a script from a physician is needed. There also is the option of we can do a screen in the office or a screen over telehealth and see if you are appropriate for physical therapy. Ask some questions, get some general knowledge of what happened, why you're feeling what you're feeling. And then we can kind of help point you in one direction or the other at that point.
Okay, great. Is there a time when people can come in the physical therapy without a referral?
There are a few instances where we can do what is called direct access, where select therapists in the company can see a patient without a referral. It's covered by the insurance at that point as well, and we can do 30 days of treatment plus the evaluation without a direct script from your physician.
Got it. So that's an option. So during this time, if someone has some pain or feeling some difficulty doing something, they could call the office and see if they qualify for coming directly in to see you.
Correct.
Awesome. So what has changed in the practice that you're seeing with this with the shutdown and with the COVID-19 and all the stay-at-home orders that have been going on?
So the biggest thing that's happened in the clinic is the biggest change is a telehealth option that we now have that before in the past we weren't utilizing and didn't really have the means to do that, or didn't have the ability to do at that point in time. So that's the biggest kind of change that we've seen in here, is the option to do that from home, to be treated from home and go and have physical therapy kind of in your living room with you.
Awesome. So tell me a little bit more. So how does that work?
So what we do is use a program called Doxy. It's very similar to a FaceTime or a video conference, where if you have a computer or a phone or a tablet or anything that has a camera, we can access it through our cameras on our computers, and we can do both evaluations and treatments over the internet. And again, it works very similar to a FaceTime. It's really user friendly, and gives people the option to stay home, be safe, not have to go out into the world to get physical therapy treatment. Because even though this COVID-19, the virus is there, and it's scary, and people don't want to go out, people's pain doesn't stop because of something like this. People are still coming in. People still have things that need to be addressed with physical therapy.
So telehealth is an option for people who don't want to leave the house. So what about the person who is willing to leave the house? What are some of the things that have taken place in the clinic for those patients that want to do in-clinic visits?
So again, lots of changes there since this all happened. One of the first things that we're doing is everybody who's coming into the office is encouraged to wear masks. All of the staff is required to wear masks while you're in here. And when you walk through the door, everybody is screened for potential symptoms, so that if somebody is symptomatic for COVID-19, we are screening them out and referring them back to their primary care physicians or to a different healthcare provider, so that we can kind of keep the people in the office as safe as possible. Going through the screener questions, taking temperatures of everybody that comes in through the door. And then we have the opportunity to, with the schedule being what it is right now, make sure that everybody is staying as socially distanced as possible.
So that means the tables are spread apart. You're only seeing a certain number of patients at a time. So describe some of that for me, if you would.
So every person that comes into the clinic for treatment has a 1-hour time schedule. That allows us as physical therapists to take more time with every therapist or with every patient that comes in through the door, and minimizes interaction with patient to patient and patient to therapist. Unfortunately, the way that we do things here is a very manual based, so we will be breaking social distancing protocols with your primary therapist, but we are trying to minimize the contact with any other staff member that's coming in through the door. Awesome.
And you're also wearing masks and gloves, so even though you're doing that contact, it's as safe as possible in this at this point in time.
Correct. We're wearing gloves. Every therapist, when they touch a patient, has gloves, has a mask on, and then when we're using equipment, we are sanitizing everything from the hand weights that we're using to, if you're sitting in a chair, we're sanitizing the armrests as well. So everything that a therapist or a patient touches gets sanitized before the next person has to touch it.
Awesome. That's great. So what's some of the feedback you're getting from patients who have been coming into the clinic for treatment?
The patients that are coming into the clinic are doing quite well, and they really appreciate the one-on-one attention that we get to spend a lot of time with them, having 1-hour blocks. So we get to maximize the amount of time and the amount of rapport that we get to develop with these people, as well as it's nice to have that personal interaction, because lots of these patients have been working from home and haven't had the social aspect of things that human beings tend to miss when they don't have when you're stuck at home, or when you're working from home and you don't have that camaraderie that you would have at work. You can have some of that here.
So the patients are experiencing a little bit more, not only pain relief because of the manual therapy you're able to do, but then that the social aspect of the physical therapy experience is there to help them with, get by and get through everything.
Correct. And it goes both ways too. The therapists they really enjoy interacting with the patients as well, because again, when we're not working, we go home and we're very isolated as well. So it's welcomed on both ends for sure.
That is for sure. So Drew, thank you very much. And on behalf of Drew, Excel Physical Therapy has 33 clinics in and around Philadelphia and the Delaware Valley. And, physical therapists are experts in movement. So physical therapists can help get rid of pain and help you to move better, to help you get back to doing the things that you truly love to do. So if pain is limiting you during this trying time, think about Excel Physical Therapy, because we have taken all the precautions to make it a safe environment for you to get the care you need. Until next time, thank you.